Ministers consider allowing first lung transplant operations in Scotland. Scots currently requiring surgery must travel to the Freeman Hospital in Newcastle as there is no facility north of the border which offers the major procedure. Surgeons, patients and charities have criticized the approach because people requiring a lung transplant usually require immediate treatment. However, the Golden Jubilee National Hospital in Clydebank, the only heart transplant unit in the UK which cannot also offer lung transplants, could soon be permitted to offer the service, following a request from surgeons. A decision is expected to be made within the next 6 months. The details emerged as Nicola Sturgeon visited the hospital to celebrate 25 years since its first heart transplant. The First Minister said, "There's a scoping exercise being undertaken right now that will report in the first half of next year, and then decisions will be made on the strength of the evidence that is available." What the exercise is looking at is the feasibility of carrying out lung transplants here as well. I completely understand the desire of clinicians who feel they have the capability, and also of patients who would prefer their operations here in Scotland rather than having to go to Newcastle, which has been the case traditionally, but we've got to make sure we take these decisions based on the best possible evidence. Professor Nalwar Al-Attar, Director of Scottish National Advanced Heart Failure Service, said surgeons were prepared to take on the extra work. He appealed for more donors to come forward to enable the transplant program to expand and added, "We are very keen on offering lung transplants to patients with advanced respiratory and lung disease. We are very much looking forward to coming up with recommendations to support our request to have lung transplantations." The Golden Jubilee has carried out 367 heart transplants since launching the service in 1991. The longest surviving patient received his heart 24 years ago. Chief Executive, Jill Young, said, "Each year we hold an event dedicated to bringing together patients and families who have been treated by the service, letting them share their experiences and see that they are not alone." This year, however, is a very special occasion for the NHS in Scotland, celebrating a landmark for this life-changing, life-saving service which has given patients all across Scotland a second chance at life. She added, "Today is a chance to look back, celebrate and remember, but it is also an opportunity to look forward at new developments and possibilities for the future to help more patients than ever before not only survive heart failure, but go on to live healthy, active, normal lives for years to come."